Welcome everybody, and thanks for your interest in this important topic. I'm happy to talk with you today about the issue of physical punishment and its relation to child maltreatment. I've been studying the effects of physical punishment on children for over 20 years. And so I'm happy to be able to share with you some of the things that I've learned and from my own research, but also from the research of others. So I want to just begin by being clear what physical punishment is. And I tend to use the definition from the UN Committee on the Rights of the Child. They issued what they call a comment, which doesn't sound very official, but it's actually one of the most official things that a committee at the UN can do. And they issued a comment about corporal or physical punishment that I'll talk a little bit more about later. But in that comment, they provide this definition, that it's any physical punishment or any punishment in which physical force is used and intended to cause some degree of pain or discomfort, however light. So the idea is that children will experience some pain, and that's actually what is the punishment. The pain is the punishment. Internationally, the term corporal punishment is used more. In the United States, we tend to use the term physical punishment when we are talking about parents' use of it. But when we're talking about the practice in schools in the United States, because it is still legal in some states here in the US, we tend to say corporal punishment. I may go back and forth because I use both terms. I also will be talking about the term spanking, which is a specific form of physical punishment. And spanking is the most commonly used form of physical punishment. So that's why we'll tend to use that term off and on. I'm not sure what the most common term is in Israel, but in the United States, a spanking means just a swat on a child's behind with an open hand, like in this photo here. So something that I have tried to make clear every time I talk about this issue is that physical punishment or spanking, those terms are just euphemisms for hitting children. Spanking in particular, it's a hitting a child. There's really no other way to describe that behavior. Physical punishment is a broader category that can include other ways of hurting children, such as making them kneel on hard objects like rice or gravel, making them stand in positions for very long periods of time. Anything that involves physical pain and discomfort would fall under physical punishment, but most parents use spanking or some other method of actually hitting children, sometimes with a hand, sometimes with an object. But we use these euphemisms, and it allows society to have more acceptance of this behavior that normally we wouldn't. We don't normally accept assault as a thing that we think is okay to do for solving problems. And with children, we are, for some reason, okay, in the United States at least, with assaulting children, as long as we say that the purpose was discipline. And so my colleagues and I have been interested in trying to figure out why this is. And so we did a study recently where we asked parents to define spanking, just to ask them, do they see it as different from hitting? And most of them use terms like hitting to define spanking, or they use terms like smacking, swatting, or striking. These are all violent terms, which just connotes the fact that it is a violent act. And so when you ask people to really think about it, they have to acknowledge that it involves hitting. But in polite society, people use the term spanking, and that is a term that, for some reason in society, we have kind of separated from hitting and assault. So when I talk about this issue, I try to use the word hitting a fair amount to try to get these terms connected in people's minds. That when we're talking about physical punishment, we are talking about assaulting children in ways that would not be acceptable in any other human relationship in our society. And unfortunately, physical punishment is prevalent around the world. UNICEF has done several surveys. Their most recent one found that of parents of 2 to 4-year-olds, 63% of them physically punished their children. And so that's a very large amount. That means most children in the world are being hit by their parents or somehow experiencing pain as a form of punishment. It's also the case that 732 million children live in countries where school corporal punishment is still permitted. There is not as much research about corporal punishment in schools. I have done some, and I've done some kind of reviews of what we know. I'm not going to speak about that research today, but if you have questions about it, I can ask more, or I can answer some questions about it at the end. But in the US, it is still legal in 19 states to hit children in the name of discipline, typically with a board, such as the lower photo there is a typical paddle that's used to hit children in schools in the US. And still about 100,000 children are paddled with those boards every year in public schools. Okay, so as I said, most of the research on physical punishment or corporal punishment has been on parents' use of it and not on schools. So from now on, I'm mostly going to pretty much talk about the research on parents' use of it. And I have participated in several reviews of the literature to find out, what do we know? What is the kind of sum total of our knowledge about the effects of spanking and physical punishment on children? And the most recent one I did was a systematic review that was published in the LANCET last year. And so you should, I'm not sure if you can still publicly access this. If you want a copy, you feel free to email me, and my email will be at the end. But our goal was to find out, what do we know? What is the literature on physical punishment and corporal punishment? And we only looked at studies that were longitudinal, that followed children over time, and that controlled for the initial behavior. So that these studies were looking at whether physical punishment predicted changes in children's behavior. That's important because, as you might expect, we cannot do experiments with physical punishment. Our IRBs at our universities will not allow us to randomly assign children to be hit or not. So we can't do traditional experiments. So instead, we have to use research designs that allow us to approximate an experiment. The very least we can do is look at over time and control for the initial behavior. So if we're looking at aggression in children, we would look at the effects of physical punishment at, let's say, age 5, predicting age 8 aggression, but controlling for age 5 aggression. So at the same point as the physical punishment. So we can see if physical punishment is effective, then it should lead to a decrease in aggression over time. That's what parents' goal is, to improve children's behavior. And so that's what we were looking for in this research. Do we see that physical punishment predicts improvements in children's behavior over time? That's what we were looking for. And here's a table from our report. And it turns out that none of the studies found that physical punishment predicted improvements in children's behavior or experiences over time. And in fact, led to detriments, in many cases, significant detrimental outcomes for children. So there's really no evidence that physical punishment is achieving parents' goal of improving children's behavior, and instead is having many negative side effects that parents probably aren't thinking about. Most parents are not thinking about the fact that they're affecting how children learn in school by affecting their brains. They probably don't think about the fact that they are affecting their ability to attend in school, or their levels of anxiety. These are all things that are associated in these studies with physical punishment. And so they're kind of like side effects because they're not the desired outcome that parents want. They're mostly focusing on these externalizing behaviors, aggression, conduct problems, disobedience. Parents are trying to reduce those things. And not only do they not reduce them, they increase those bad behaviors, and they have all these other negative outcomes for children. And so we were pretty gratified that the editors of the Lancet put this quote on the front cover of the Lancet when our article came out last summer. There's no time to waste. All countries should heed the UN's call to uphold children's human rights and promote their well-being by prohibiting physical punishment in all forms and all settings. And I'll talk more about the status of such prohibitions later in my talk. But we were pretty excited that the editors agreed that that was a pretty important outcome of our article. I've also done 2 different meta-analyses of the research on spanking or physical punishment. The most recent one was in 2016, this one that I have up here. And a meta-analysis takes all of the research that's available and summarizes it, taking into account how large the sample sizes are in each study. And we found 75 studies that we could use for analysis. They were conducted over 50 years and from 13 different countries. And in total, 160,000 unique children were represented in these studies. And so the first question to think about when we looked at our meta-analysis was, does spanking, so in this case, we are mostly looking at spanking behavior, does it improve children's behavior? Is it effective? Turns out, no. It does not make children more compliant in the short term. So right in the moment when parents spank their children, there have been several studies that have followed the children in the next few minutes or hour or so. And children who are spanked are not less likely to repeat that behavior. They're just as likely as kids who've not been spanked to repeat the behavior again. So it's not effective right in the short term. We also know that it's instead, well, it's not linked to reductions in aggression or antisocial behavior, just like we saw in the LANCET paper. And it's not linked with long-term compliance. So when we think about not in the moment, but are children learning how to behave well into the future? Are they learning skills that will, are they internalizing morals? Are they learning how to be pro-social with other children, with adults? Are they learning these skills that most parents really value? And unfortunately, no. And actually, spanking is linked with worsening of all of those things. And so we found that spanking was associated with more aggression, more antisocial behavior. So even though this is one of parents' main goals when they're using spanking, when we ask parents in other studies, they say they want to reduce children's aggression, ironically. None of the studies showed that that's effective. And in fact, it's making their behavior worse, which in turn is making parents' job worse, which is an argument I try to make when I talk publicly about this research, is parents are actually making their lives harder by spanking because they're making the children's behavior worse. So again, we looked at these unintended outcomes in this meta-analysis study as well, and we found that the more children are spanked, the more mental health problems they have, including anxiety, depression, or suicidal ideation. They have more difficult relationships with their parents. They have lower self-esteem, and they have lower academic performance. And again, each of these are outcomes that parents are not, they don't think they're affecting them when they're disciplining. When they're disciplining, they're really thinking about this kind of disobedient behavior, and they're trying to correct that. But it's also having these unintended outcomes that they are not intending to affect. And then there have been some studies that have looked into adulthood, either by following children over time or by doing a retrospective study where they might ask adults about their mental health now and then ask them to recall their childhoods. And these studies reveal that a history of spanking is related to more mental health problems, more antisocial behavior as an adult, and more positive attitudes about and use of corporal punishment or physical punishment with their own children. And that is troubling because that means there's this cycle of violence from generation to generation. It's just getting passed down. You know, parents are our main models for how to parent. When we have our own children, we think back to how our parents raised us. And if we were hit, then we're more likely to hit our own children and to believe that's an acceptable behavior. Attitudes about physical punishment have decreased, at least in the United States, over the last 20, 30 years. But still, a majority of Americans think it is okay to hit children in the name of discipline. So spanking is still very common in the United States and around the world. The next outcome, yeah, okay. So one other question that has come up is whether spanking is linked with physical abuse. And again, I put to you that spanking is a form of hitting. Physical abuse is often hitting. So the behavior at its core is the same. And so family violence experts have been arguing for years that spanking and physical abuse are on a continuum of violence against children. And so there's one article that I've cited here below created this continuum, which I think is helpful to think about, that any type of hurting or physically affecting children, starting with just shoving, slapping, spanking, bruising, burns, and broken bones. Clearly, burns and broken bones are very serious behaviors. And in the United States and most countries, those types of behaviors are considered to be abuse. And typically bruising is as well. And then on this continuum, we kind of draw an imaginary line between those brackets to kind of say, well, these behaviors on the right, we think are not acceptable, and we will call them physical abuse. These other behaviors on the left, we're going to say those are okay. And so what happens, at least in the United States, is that judges, when a family is brought to the court by the child welfare system, a judge gets to decide whether a parent's behavior is on the acceptable part of the continuum or the unacceptable part of the continuum. And in the end, it's fairly arbitrary. I think if you instead thought about this as husbands hitting their wives, and let's think about this as a continuum of violence against wives, would we say that it's okay to draw a line between slapping them and hitting them so hard they get a bruise? Probably not. 50 years ago, there would have been something like that. But now our attitudes about violence against children or against women have changed. It is no longer acceptable for a man, for a spouse to hit his wife just because she's his wife. But that was acceptable for a long time. And the laws actually didn't really support prosecuting husbands for that behavior. That changed. Although it didn't change that long ago. Our first federal law in the United States about criminalizing violence against women was in 1994. That was not that long ago. And some of you may know that it was President Joe Biden, when he was a senator, he created that legislation and pushed it through. So I present that just to kind of have you think about, why is it as a society that we no longer allow we don't accept any kind of violence against adult human beings. All these things are not acceptable. But for children, we kind of compartmentalize some of these behaviors to be acceptable and some to be not. When I talk later about the bans on physical punishment that have been happening around the world, those countries have decided that these arbitrary lines are frankly ridiculous, that there should not be an arbitrary line. We should move the line all the way to the left to the very end, that any form of violence or hitting children or hurting children is unacceptable. But most countries in the world have not got to that point yet. I also find this study pretty compelling. Some colleagues of mine in Canada years ago did a review of all physical abuse cases and looked to see what the precipitating cause of the abuse was. And in 75% of the cases, parents said they were intentionally physically punishing their child. So the child did something that they didn't like. And so their goal was to discipline them, but they got carried away. They either hit the child too hard or too long, or they used an object and they hurt the child. And to me, this is a pretty sobering and tragic statistics that these are all preventable injuries. If the parents had followed their desire to discipline but used another method, then they wouldn't have hurt their child. The desire to discipline, the instinct to discipline is a good one, but hitting is not the right way because it can lead to this injury and many other negative outcomes. We also know from our meta-analysis that when we looked at studies that had asked the same participants about spanking and about abusive behaviors, like using objects, for example, we found that the associations were very, very similar with negative outcomes for spanking and for physical abuse. So I'm going to show you a table. I'm sorry, this is a little bit blurry, but all you need to really do is look at these bars here, the black and gray bars. The gray bars are spanking, the effect size for spanking, and then the black bars are the effect sizes for physical abuse. And for each of these studies, again, these are the same people. So we're not comparing different people. We're comparing the same people and their experiences with either spanking and physical abuse. And for most of the studies, this black bar is larger than the spanking bar, the gray bar, showing that physical abuse is having more negative impact than spanking. However, you see there's a couple of studies, this Bugenthal study and then the Schweitzer study, where the gray line is actually longer than the black line. The spanking effect is actually larger than the physical abuse effect. So when you put all these together, you get these two averages at the bottom. And so what we can see is that they both are leading to detrimental outcomes. That's what's on this side of the zero line, detrimental. That when children are spanked, they're more likely to have negative outcomes. When they're physically abused, they're more likely to have negative outcomes. That's something we definitely agree on as a society. This is why we have child welfare laws, is because we understand that physical abuse is harmful. But if you look, spanking is just a little bit behind. And in fact, it's just 2/3 the size of that association for physical abuse. So as a society, we've already said physical abuse, very bad, bad for children. Spanking is just a little less bad. And so, but we still haven't quite accepted that as a society and admitted maybe we should probably not be doing any kind of hitting. Yes, physical abuse is bad. Yes, spanking is not quite as bad, but it's bad. It's not having any positive effect on children. And you see there's no beneficial outcomes. I should just point that out quickly. None of the bars are going to the beneficial side. So these findings support this notion of the continuum, that physical punishment and abuse are on this continuum of violence against children. They're both associated with the same negative outcomes with spanking or physical punishment, just to a slightly smaller degree than physical abuse. A recent study that I did not do, but colleagues of mine did at Harvard, looked at whether physical or corporal punishment in childhood was linked with children's brain structure and functioning. And so they did brain scans of a couple hundred children, and they found that the children who had been spanked or physically punished had more brain activation in response to threat. So they were shown pictures of threatening faces, and they were hyper responsive to those faces, much more so than the children who had not been spanked. And so the idea is that this activation is happening in areas of the brain that are basically dealing with threat and that kind of fight or flight response. And so children who are hit repeatedly by their parents, that stress response system gets activated, the fight or flight response gets activated, and over time, these areas of the brain begin to get hyper responsive because they get activated over and over. And so these are areas of the brain that are, these particular areas, they're really focused on how children take in social information. So when they see a situation, do they see threat? So for example, a common scenario that they might present to a child is the child is at school, they're in the cafeteria, another child walks by with a tray, bumps into them and spills their milk. And so the child is asked, did that child do it on purpose or was that an accident? And children who are hyper attuned to threat will say, ooh, they did it on purpose. They did that to embarrass me or hurt me or something. Children who are not spanked and are not kind of hyper aware to that threat, they'll be like, oh, it's just an accident. So by this kind of hitting is actually changing how children, how their brains work, how they interact with their environments, how they process information in their environments. And clearly this is not something that parents have in mind when they're spanking. They're not thinking that this is going to be happening to their children. And this study is pretty fascinating because we've had we've had only a couple studies before that have looked at whether brains are affected by hitting in this way. And this is starting to help us understand why spanking and hitting are having the negative outcomes that we see. It's because one of the reasons is because of the stress response system and the effects on children's brains. And what they also say in the article is their effects look very similar to studies that have been done on individuals who've experienced abuse. So the same areas of the brain are being activated among children who've been spanked or physically punished as among people who have been physically abused. So again, it looks like the effects on the brain that are happening because of physical punishment are the same things, same kind of changes we're seeing related to physical abuse. And again, supporting this idea that there is a continuum of violence against children. It's also interesting to note that in the United States, there are several states that have linked physical abuse and physical punishment, or corporal punishment as they typically call it in law, in their state codes. So several states have said that physical abuse can include cruel punishment, excessive corporal punishment, or excessive or unreasonable corporal punishment. These are just a few examples. So the very fact that a state admits that there are cases of excessive corporal punishment, they have already made that continuum. They've already agreed there is a continuum and that corporal punishment can become abuse if it's excessive. Now, again, there's no definition of what excessive is or what unreasonable is or what cruel is. That is left up to caseworkers and judges and sometimes police officers to decide whether behavior is excessive or cruel or unreasonable. But it's very telling to me that this is already in many states' laws. So I want to say a little bit about ACEs. So hopefully all of you are familiar with the term ACEs, Adverse Childhood Experiences. This has become a really commonly accepted way of understanding that negative experiences in children's lives early on have long-term impacts on their mental health as well as their physical health. And so there was an original ACEs study conducted by Ph.D. and his colleagues in San Diego. They interviewed 14,000 adults and asked them to recall their childhood. The study was based on the fact that Ph.D. in his own practice, and he had a clinic on obesity, found that many of his patients recalled trauma in their childhoods. And even though his goal was to really treat their obesity in the present, he realized he could not do that unless he addressed the trauma from their childhoods. And he's not a psychiatrist, he's just a medical professional. So in this study, they created a scale known as the ACEs scale that asks about 10 different types of potentially traumatic events that children experience in their childhoods. And we found out, colleagues of mine and I found out, they also asked a question about spanking, whether they'd been spanked as a child. And so my colleagues and I thought, well, let's look and see, does spanking look like the ACEs in this original study? So we were able to get access to the data. The data now is housed at the Centers for Disease Control and Prevention in the US. And with colleagues there, the first three authors were all at the time working at the CDC. We worked together to analyze that data and to kind of compare them. And so I'm going to do now what I normally don't do, which is show a bunch of numbers in a presentation, which I know is kind of a faux pas, but I hope this will illustrate for you what we found. So you can see we have in the first three rows, actually, let me just say what our outcomes were. We were looking at drug use, lifetime drug use, moderate to heavy drinking, lifetime suicide attempts, and depressive symptoms. And the first three lines are going to be the effects for each of the kinds of recognized abuse. So sexual abuse, emotional abuse, physical abuse. You can see that sexual abuse is associated with all four of the outcomes. These are adjusted odds ratios. So these are adjusting for a range of sociodemographic characteristics of the individuals, such as their gender, their race, their economic status. And the odds ratio is interpreted, you basically focus, if it's a 1, there's no effect. Anything larger than 1 means that the ACE is leading to an increased risk of the outcome. So for example, sexual abuse is linked with a 48% greater chance of having a drug use in one's life. And so you can see sexual abuse, emotional abuse is really only linked with suicide attempts. Physical abuse is linked with drug use, heavy drinking, and depressed affect. And so those are kind of the accepted kind of, I should have actually moved that little bar above the sexual abuse line. Sorry about that. So that's what we accept. As a society, we say, yes, these are bad things. And so we shouldn't be surprised that they link to harmful experiences in adulthood. But what is surprising is that the effects for spanking are very similar in size. That spanking leads to a 42% greater chance of drug use, a 29% greater chance of moderate to heavy drinking, and a 39% greater chance of a suicide attempt. And then you see some of these other outcomes, ACEs, that are typically included. So physical neglect, their mother was a victim of violence in the home, divorce. Those are not linked to any of these 4 outcomes. So spanking is actually a bigger predictor, a better predictor than some of these typical ACEs. Typically when people use the ACE score, they just use, it's a 0 to 10 measure. They just count them up. And so we thought it was important to really look at the specific ACEs, and I'm glad we did, because some of them are not predicting, and spanking is predicting much better than some of these other accepted ACEs. So we made the case in a couple articles that as a society and as researchers, we should be considering spanking as another ACE. So I want to talk a little bit about a couple other questions that come up about the research. And so one question is whether the outcomes that we see linked with corporal punishment or physical punishment vary by country or culture. And there's a common argument that when a practice is common or normative, it should have less negative effect on children, because this is just what happens. And so for children, when you misbehave, you're just going to get spanked. That's just what's going to happen. And the idea behind this theory is that there should be fewer negative effects of spanking because it is normative in that culture. I have a lot of issues with this theory because if you take it to a not very far extreme, you could say the same thing for physical abuse. You could say the same things for all kinds of practices that we do not think are okay, genital mutilation and things like that. As a world society, we do not agree that those things are okay just because they're normative in a society. So I'm not a big fan of this theory. And so I wanted to see, well, how does this theory hold up in research? And this theory was first developed by Ken Dodge and Kirby Dieter-Deckard based on data from one of their studies in which they found that spanking was associated with worse antisocial behavior for white children, but for better behavior for Black children. And so to try to understand that difference, which again was just one study, and it was not a very big study, and they confounded race and income, unfortunately. They only recruited low-income Black families for some reason, but they never really say that in their articles. They came up with this theory based on that finding. So I wanted to find out if that was true. So a colleague, so actually Dieter-Deckard and Dodge were part of this project. Jennifer Lansford at Duke had a study of mothers and children in China, India, Italy, Kenya, Philippines, and Thailand. And so we looked to see across all those countries, does spanking predict aggression and anxiety? And it did. Across all those countries, the more children were spanked, the more aggression they exhibited and the more anxiety they experienced. And the study also asked parents and children how often or how normative they thought it was in their communities to try to really get at that question. Do they think it's normative, and maybe does that moderate any of the negative effect? And it didn't. There was still, in all the countries, regardless of how normative it was, how normative parents or children said that spanking was in their communities, it was still linked to negative outcomes, still led to more aggression and to more anxiety. And so then I wanted to do the same thing in the United States. And in the United States, many studies, unfortunately, use race as a marker of culture. It's not a great measure. Race and culture overlap, but not perfectly. But because that's what many studies in the US do, that's what we did for this study. So we looked at a study of 11,000 children. This is a nationally representative study here in the United States. And first we looked at how often parents spank, and Black parents did spank the most. But you can see that the majority of all parents spank. So yes, Black parents spank the most, but 80% of Latino parents, 78% of white parents, and 73% of Asian parents. So most parents in the study were spanking. It's just there's a little bit of difference in these percentages. So then we wanted to see, well, does spanking predict changes in aggression over time the same for each of these groups? And so we took these differences into account. And then we found no differences. That once you took that frequency into account, there is no differences for all children, regardless of those race or ethnic groups. The more they were spanked at age 5, the more they increased in their aggression from age 5 to age 8. And so it was the same for all of the groups. We found no difference at all. So we found no support for this idea that even though it's slightly more normative, you could say, in the African-American Latino parents, it's not better for children when they're spanked. It's just the same. It's bad for all children. So there's no support for, we have found in our research, no support for this normativeness theory, either in international samples or in this US-based sample. Another question I sometimes get is whether it helps if a parent pairs warmth and love with the spanking. So parents will often say, oh, well, I spanked them, but then I gave them a hug, or I told them that I love them, or something like that, which is you can imagine children are very confused. It's a very mixed message to get hit and then be told that, you're loved by somebody. But that's a pretty common belief. So my colleagues and I wanted to test that. So we tested that in a different sample of 3,000 children across the United States. This time we looked at spanking at age 3 and increases from in aggression from 3 to 5. And spanking led to increases overall, and how much warmth the parents expressed to their children did not buffer the negative effects of spanking. Spanking predicted worse outcomes for children regardless of whether the parents hugged them afterward. We also found that the more warm parents are, the better behaved their children are. That's kind of fits with everything we know about parent and child relationships. And the opposite was true for spanking. That parents who are loving and warm and engaged with their kids, those children behave better. The more spanking a parent does, regardless of that warmth, the worse children's behavior. So to some, we found no evidence that warmth moderates this association between spanking and aggression. I should have put this earlier. Sorry, this is actually looking at UNICEF data, the mixed study, which looked at over 60 countries around the world, low and middle income countries. And in this study, they were looking at corporal punishment and children's social emotional behavior. And for every single country, these researchers looked at the effect. Is corporal punishment linked with better social emotional behavior or worse social emotional behavior in all these countries? And you can see this across all the different continents and kind of all over the world. And so if I'm going to show you lines that kind of show the effect sizes for all of the countries. If corporal punishment is improving kids' behavior, then we'll see them on the right side under this green box. And then if it's making their behavior worse, we're going to see the lines under the red box. So let me open the green box first. And there are no lines over there. These are just the ends of two lines that are crossing 0 and are not significant. So, as you might expect, all of the countries are seeing that the more children are spanked, the worse their social emotional behavior in every single country, except for these two at the top, Chad and Ukraine. These are not significant because the lines are crossing zero. But for every other country, the more children are spanked, the worse their behavior is. So this, again, does not support this idea that in some cultures or countries, it's normative and it's going to be good for kids there. No. Every single country, children's behavior is worse when parents hit them. So those are all kind of the research considerations of why parents might want to rethink hitting children. But another reason is that the UN considers it a violation of children's human rights. And so that comment that I mentioned earlier, comment number 8, is focused on corporal punishment of children. And in it, the UN states that physical punishment or corporal punishment is a form of violence. They say that very clearly. That's inconsistent with the Convention on the Rights of the Child. And the UN has called on all countries that have ratified the convention to prohibit all forms of physical punishment. They've said it very clearly, consistently. And now every year, or every 3 years, when a country gets, when the Committee on the Rights of the Child evaluates a country to see how well it's adhering to the convention, every time now the committee puts in its report, if they haven't already banned physical punishment, you need to ban physical punishment to be in compliance with the convention. And so that applies to all countries in the entire world except one, and you may know which one it is. It's the United States, because we have not ratified the Convention on the Rights of the Child. Even though we helped write it decades ago, and even though under President Bill Clinton it was signed, but it's never been ratified by the Senate. It's never even been brought for a vote. So sadly, the US is definitely lagging behind in protecting children. And so this call from the UN is not having an effect on the United States. But I still like to bring it up because to me, it's very compelling. And it's compelling to countries around the world, such as the 63 countries that have already banned all corporal punishment of children. And so you can see the very first ban was in 1979. That was Sweden. And by now we have 63 countries, and I'm going to show you the full list in a second. But this website, or this organization, End Violence Against Children, they track, all this, everything we can know about bans and progress to banning it around the world. Right now, you can see that 14% of all children in the world are fully protected. 76 are protected in some settings. So if it's banned in schools, for example, and then 10% are not protected at all. So, I guess the good news is there's at least bans on corporal punishment in schools or detention centers or child welfare settings in most countries. It's just that the 76 countries have not banned parents from using corporal punishment. Here's the full list of all of the countries. And you can see that Israel banned it in 2000. And the most recent was Korea and Colombia. Colombia banned it in November. And one of the things they cited was that brain study that I showed you about that was really compelling to the legislators there. In no small part because the first author is from Colombia. He's a graduate student at Harvard, but he's done a lot of research and is really done his part to inform legislators in his own country, and they were swayed by his research, which is really wonderful.
Professor Gershoff, sorry, just to say that you have 2 more minutes.
Okay, great. So this is just a map to show you this kind of legal status of corporal punishment around the world. And I think it's helpful to see this because most people think, oh, it's just Europe. It's not just Europe. It's actually most of South America, several countries in Africa, Mongolia, New Zealand, Korea. So it's countries all around the world. And so there's a growing movement to protect children by banning corporal punishment. And actually, so Ireland has banned it, and then Wales and Scotland have banned it, but England hasn't. So the UK is not yellow yet. even though two parts of the UK have. Well, I guess two have and two haven't, and Northern Ireland hasn't either. And so just to kind of, I just want to kind of put a couple of things in perspective. The Centers for Disease Control and Prevention released this toolkit and said that in order to prevent child abuse, we need to ban corporal punishment in the United States, which is pretty important to know that a US agency said that. There are now 5 professional organizations that have called on parents to not use physical punishment and have called on their members to encourage parents not to use it, including the American Academy of Pediatrics and the American Psychological Association. I'll skip over these. These are just the resolutions. And then I'll just quickly mention an intervention that I can answer questions about that I've been involved with called no hit zones. These are, I'm really fascinated by this intervention because it's very low cost and it's about changing norms actually, but changing norms about acceptable behavior. And they follow the same logic as no smoking zones. And so all of us old enough to remember when smoking was everywhere, no smoking zones were a way of kind of slowly showing people that it's not acceptable, that your peers don't want to be around smoke anymore. If you're going to smoke, you're going to go to this other area. And no hit zones are trying to show people this organization that has a no hit zone is not in favor of hitting of any kind, including hitting or spanking children. And so no hit zones started in hospitals. They've spread now all over the country. I've done some research on them, and I'll just quickly summarize and say that we found that it did change the staff members' beliefs about hitting, and they were definitely less in favor of it, and they were more willing to intervene if they saw hitting. The reason why these hospitals did this is because they were seeing parents hit children in the hospital, which is stressful for staff, it's stressful for patients, it's stressful for visitors, and so that's why the hospitals started this in the first place. And so now they're in dozens of hospitals. This is kind of an example of a poster that they use. I'm going to skip over this. And just to say that no hit zones have been implemented in many interesting places, including this district attorney's office in Wisconsin. And 2 cities in the United States have become no hit zones. So Stoughton, Wisconsin and Madison Heights, Michigan have both, as the city, become a no hit zone. And they put up these signs and try to educate parents in all publicly, city-owned areas. So libraries, schools, playgrounds, things like that. They put up signs to try to discourage spanking or hitting and encourage parents to use other methods. And if you want to learn more about no hit zones, this is a website that colleagues of mine have put together to just freely distribute information and sample signs and stickers and things like that for people to use if you want to make your organization a no hit zone. And we had planned to have a no hit zone conference in a couple of weeks. I was going to host it here at the University of Texas, but because of the pandemic, we've delayed it. It was going to be in November, then it was going to be February or March, and now I think it will be sometime in the summer. But if you're interested, you can look at this website and kind of follow along and keep an eye out, and we'll reschedule it at some point. We just haven't done that yet. So thank you for your attention. And this is my email address. Feel free to email me if you would like a copy of these slides to get any of those links.